Okay, so today we are going to have a quick conversation with Marisa Stahl, who is one of the scientists working on research into celiac disease. So first we'll have Marisa tell you a few things about herself, and I should also say Dr. Marisa Stahl. So take it away.
Thanks, Amy. Yes, and I'm happy to be here today. And I am a junior faculty member at the Children's Hospital of Colorado, an assistant professor of pediatrics. And I actually started my fellowship in GI and hepatology at Children's. Oh gosh, it must have been 4.5 years ago now. And that was when I first discovered celiac disease research and have become hooked ever since. And now I also work at the Colorado Center for Celiac Disease.
So I think it's good for all of us that you got hooked. That was serendipitous for us. I know that a lot of the work that you do is in screening for celiac disease in children. So can you tell us a little bit about that?
Yeah, so celiac disease, I think one thing that's really difficult about diagnosing celiac disease is that the symptoms can be really, really nonspecific. And so a lot of children and adults for that matter may go years with symptoms before it's ever recognized to be due to celiac disease. And so then the question, becomes really, should we be screening everyone since it can be so hard to identify based on symptoms? And there are definitely caveats to that as well, too, because if you're recognizing people who are completely asymptomatic and putting them on a gluten-free diet, what are the risks and psychosocial complications from that as well. And so our research is focused on universal screening for celiac disease and kind of weighing those risks and benefits and being able to reduce the time to diagnosis, but also balancing that with potential complications and risks from identifying people who are completely asymptomatic.
Right, and so when you're talking about screening, it's a slightly different thing from my child doesn't feel well, I'm taking my child to the doctor to find out what's wrong. These could be children in whom celiac disease is picked up and there are no symptoms at all.
Yeah, that's absolutely correct. A lot of the children who are participating in our screening study, the screening kind of gets tacked on to their pediatrician appointment, or they may be coming to urgent care or the emergency room for something completely unrelated, an arm fracture, or the many other things that children, go to the doctor for.
And so you had mentioned this balance that there is between the need to be on a gluten-free diet, even if you're asymptomatic, and then some of the quality of life issues and mental health issues that can accompany being on a restrictive diet. And we are seeing that there is more research being done into these aspects of celiac disease. What are your thoughts on that topic in particular based on your body of work?
Yeah, that's something that we are very, very interested in. And I think that there's not a lot of data out there in terms of how that affects children who are screening identified and asymptomatic. And it actually gets really, really difficult to tease out because a lot of times people may be having symptoms that they don't even realize until they go gluten-free. And so that's one thing that we're interested in addressing with this study is, how do you help differentiate these different groups, people who are symptomatic, people who don't have symptoms and get better when they go gluten-free, and people who are, completely asymptomatic, and how does going gluten-free affect all these different groups when you're screening identified.
Right, and even that description, I think, points to how complicated the story can be in celiac disease. I should note that Dr. Stahl is a recipient of a Beyond Celiac early career research grant, one of the goals of which is to encourage young researchers to study celiac disease. And so I guess the question I would have for you, Marisa, is do you see yourself studying celiac disease for the long term, and why? What would your motivation there be, or why would you be interested in doing that?
I can't see myself doing anything else to answer your question. I see myself doing celiac disease research for the rest of my career. And, you know, I think the questions of how do we get better at diagnosing and how do we balance all these different factors that play into who gets screened, how to prevent people from going years with symptoms without a diagnosis, and how to best responsibly treat the people that we are identifying. I think that that's a career's worth of research. But I think beyond that, another thing that our center is becoming more interested in is how do we apply personalized medicine to that? Because I think right now celiac disease is very much a one treatment diagnosis. The only thing we have to offer is a gluten-free diet, and we don't really differentiate people based on symptoms that they have initially. And so how do we use science to better do that?
Mm-hmm. So just listening to you, it makes me think that we're lucky to have people like you who are thinking about celiac disease in that way. My daughter was diagnosed when she was a very young child and grew up with celiac disease, and now I have 2 grandsons. So it gives me reassurance, and I think the community at large, some reassurance that we have young, talented, US-based researchers doing a lot of work in celiac disease. And I think the future then holds a lot of promise for some solutions beyond that gluten-free diet. So I wanted to thank you for joining us today. It is always a pleasure to have a conversation, be it long or brief.
Thank you so much.
Okay, have a great day.
Thanks.